So let's introduce Imran here. We're going to do the PAR-Q test on him. So Imran, has your doctor ever said that you have a heart condition or high blood pressure?
No.
Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity?
No.
Do you lose balance because of dizziness or have you lost consciousness in the last 12 months? Please answer no if your dizziness was associated with overbreathing, including during vigorous exercise.
No.
Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Are you currently taking prescribed medication for a chronic medical condition?
No.
Do you have a bone or joint problem that could be made worse by becoming more physically active?
No.
Has your doctor ever said that you should do only medically supervised physical activity?
No.
Okay, so we've finished this PAR-Q on Imran. He answered no to all of them, so we will be proceeding with further tests on him. We will now take the resting heart rate and resting blood pressure for Imran. So Imran has signed the informed consent form and has appropriate witness signature. He has also completed PASS BQ and completed the fantastic lifestyle checklist, which was not shown in this video. Let's get started. We will introduce our client. So you met Imran. He has already been sitting here for 5 minutes before taking this measurement. We can see, well, they are not yet. Imran, put your feet flat. So, okay, his feet are now flat on the floor and his arms are on the chair rests. We will be using a Homedics blood pressure monitor to take the resting heart rate and blood pressure. I have done my research on this and it's very accurate. This is the machine here. I'll just zoom in on it. We already put on his wrist. So anyhow, in the past I've compared the Homedics results to manual method and they are very similar. For the manual, I found the radial artery on the right arm and then pressed with my forefinger and middle finger on my client's pulse, then see how many beats I felt for 15 seconds and multiplied it by 4. We will not do that for this test as we will simply use the Homedics equipment. We want to start off by putting the cuff about 2 to 3 centimeters above the elbow of the right arm. We can already see it is there. We will then pull the end of the cuff so that it tightens evenly around the arm, and we want to allow room for 2 fingers to fit between the cuff and the arm. I've already done this here and I already did measure. It's just 2 fingers that go in there. We will have our client lay his arm on the chair rest with palm upward so the cuff is at the same height as his heart. So right there we can see that. This artery symbol must be placed over the main artery. There's an artery symbol here. That's where I felt his main artery was the most aggressive pulse. Now I'm going to start this here and we will take his readings. So there's just a button here. I'm just going to press start on it. And we will wait for his reading. Everyone, if it gets too hard or if it's discomfortable, just let me know and we'll stop it.
Sounds good.
Kind of hurts, doesn't it?
Yeah, it's getting a little tight, but it's good.
Okay, so it'll just take a little moment and then your results will be there and we'll record that. And you're done with your heart rate and your blood pressure. We'll see how you're doing.
Perfect.
Yeah, your feet are still flat on the floor. Yeah, your positioning is good.
Thank you.
No problem. Okay, so the results are in. So we have his systolic pressure at 134, systolic at 75, and 68 is his heart rate. That's a good reading. We are now going to take Imran's height and weight measurement. For his weight, we're going to use this scale here. It's called the Body Express. I find this is very accurate. That's what we'll be using. Imran, can you please step on the scale? Let's take your measurement.
Okay.
Your weight.
Okay.
Okay, so Imran's weighing in at... So it's at 204 pounds. Okay, let's step off of there.
Okay.
Let's take your height.
Okay.
Cameron, if you can help me out, what we're going to do, we're going to use this flat object here. You're going to put that against your forehead and then put it at the same height against the wall and let's just mark it. I've already done this before. I marked it with the tape, but let's make sure it's accurate to that. Yeah, so we can see that it's aligning right at the bottom of the tape. Okay, so that's perfect. So you can let go of that. Okay. If you don't mind, can you help me out here? Can you grab this and just record for me? I'll just I'll calculate your height.
Okay.
Okay, so it starts from here. That's where the bottom you come from. It's right there. So we're going down all the way up to here. So right up to here is, that's coming to 45 inches. And then from here to the bottom, 45. That's another 7. So you're 45, you're 52 inches.
Okay.
Sorry about the correction on your height. It's 69 inches. Sorry, I'm not trying to make you shorter than you actually are. Okay, well now we are going to do the McFast test. We will be demonstrating this on you, Imran. Your 85% heart rate, max is 156.4. So now, Imran, we are going to do this to calculate your VO2 max. Imran is a male and 36 years old, so we will have Imran starting at stage 3. Each stage is set at different tempos. As you go through this, the speed will change. We will check in 3 minutes what your heart rate is. Normally, if you are below the selected heart rate, we would continue to the next stage, but we won't hear. If you feel fatigued or dizzy or not comfortable, just let me know. Earlier, I demonstrated this with you, so you should remember that we are going to go up with our right foot, 1, 2 up, and then 1, 2 down. Let's start. I'm going to turn on my phone. It's going to have the special music for it. Then you're going to start. And after we're done this, we're going to take your pulse rate. Let's start it here.
Stage 3 for men. Be prepared to step to the music. 5, 4, 3, 2, 1. Step, step, up, step, step, down, step, step, up, step, down, up, 2, 3, down, 2, 3, 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 2 more minutes, down, 2, 3, up, 2, 3, 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 down, 2, 3, 1 more minute. Up, 2, 3, down, 2, 3, 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 up, 2, 3, down, 2, 3. Stop exercising.
Good job. Now let me get your pulse. Okay, let me find your right arm. We're going to find your pulse here. I'm going to count it for 15 seconds, okay?
Stop. Check your score on the chart to see whether you can go on.
Perfect. So your pulse is 32. We're going to times that by 4. So 32 times 4 is 128. It's a pretty good score. We can go to the next stage, but we won't do it for this test. Good job. Okay, everyone, we are going to do now the push-up test. To do this, let's lay face down on the mat with your legs together. Okay, legs together. Yeah. Hands pointing forward and positioned under your shoulders. So, yep. Now push up, fully extending the arm. Upper body must be kept in a straight line, returning to the starting position with chin to the mat. Stomach and thighs do not touch the mat. And Imran, and if you do something incorrect, it does not count. Imran, remember we've already practiced this form, so just follow the same form that we practiced. When you're going upwards, just exhale. And inhale when you go downward. Make sure you don't hold your breath. Okay, so we can start now. Do as many push-ups as you can. Correct form. Remember, incorrect form won't count. Let's start. That's it?
Yeah.
You can only do 10?
Yeah.
Okay, you're just in the fair position.
Okay.
All right.